I didn't coin the phrase. It was somebody did it, decades ago, but it's about delivering the right care at the right time in the right care setting. And so we are spending a lot of time ensuring that those that present, particularly, the majority of our admissions in our care is done through the emergency department. We see roughly 98,000 visits a year in our majority of our inpatient census, which is over 550 on average, comes through the ED. So we have to ensure if you present to the ED that coming into the hospital is the right care setting for you, because it's an expensive care setting. It's also a high risk care setting, it just is. And so if we can deliver safe and effective care in the emergency room and then allow you to continue your health journey with primary care, especially in the outpatient space, that is what we're going to do for our community. So that ultimately preserves and uses the right resources at the right time. And because the hospital is an expensive care setting, and it's not necessarily the right place for everyone. Sometimes we can handle things, in the outpatient market. And a great example of that is there was a time when you would go to the emergency room for strep throat 20-something odd years ago, and we'd treat you. Today, you shouldn't do that. Go to urgent care, go to your primary care. So it's redirecting and continuing to help our community know where's the right place to go and hopefully get you there the first time. And so that's where we're spending a lot of our effort today, because that helps with also just the flow, patient flow through our facility. And then I'd say what we do a lot of partnership with our clinicians and physicians and using data. And so data is very, very important for us. And so we can look at, resource utilization, test utilization, imaging utilization, and using best practice care pathways to say, do we need to do this test or do we not need to? Using the EMR to say, well, we just did, as an example, we just did a CT, a couple of days ago in the outpatient environment. Now they've presented with a different condition to the emergency room. Do we really need to do another image, or can we use that one? Sometimes the answer is we can absolutely use the previous CT. Sometimes the answer is we can't. But that is that's an intentional. There's an intentionality around making that decision and not just ordering another scan because we can. So, and all that helps ultimately deliver better care, safer care, and begins to bend the cost curve, which ultimately is good for all of us. And remember, we're a public institution, and so our stakeholders are our employees and our citizens here. So I live in Hollywood, and so I have a vested interest in understanding where my tax dollars are spent, and so we're really proud that we don't have to go to the taxpayers and say, we need a subsidy from you. That does not happen with Memorial Healthcare System, and we want to ensure that we continue to be able to deliver, the high care, great experience, and not need the tax dollars to subsidize care.